I take her on my bike.
Hi, I'm IvyProsper. Good evening and welcome to the Maternal Health Channel television series, the program which aims to help raise awareness about the importance of reducing the high incidence of maternal mortality in Ghana and improving the reproductive health status of Ghanaian women. As part of the concerted drive towards achieving the United Nations Millennium Development Goals by 2015, this public platform hopes to broaden the scope of the national debate by incorporating voices and perspectives from marginalized communities and making maternal health issues relevant to the daily lives of all citizens. Over the past 6 months, our roving film crew has toured the length and breadth of Ghana and will be bringing you the latest news and developments in the maternal health sector, community issues and concerns, as well as unique stories that put a human face on the health statistics. This evening, we travel to Keta in the Volta Region of Ghana to bring you a special report on the state of maternal health services there and the story of Charity, a popular local woman who died from giving birth. We are in Keta in the Volta Region of Ghana, known for its beautiful beaches and its hard-working people. Uniquely, 35% of Keta's landmass is covered in water, like the lagoon you see behind me. With a population of just over 200,000 people, Keta serves as a commercial nerve center for all of the small towns and villages that surround it. Keta is an important center for healthcare in this area. The whole municipality has just 2 hospitals, including the Keta Municipal Hospital behind me. There are no special facilities for women and children, and the facilities that do exist are often outdated or run down. The hospital resources are under severe pressure, and the staff is left struggling to treat patients with adequate care. Each doctor, and there are only 2 of them, attends to an average of 29,000 people, and there is 1 nurse for every 1,500 patients.
Dr. Dereka Martin. I'm actually a general practitioner here in Keta Municipal Hospital. I'm in charge of the maternity unit. Together with the other doctors, see most of the cases here. Our daily routine is usually pretty hectic because we are really short of staff. We are only 2 doctors here.
Most days, patients have a long wait before they see a doctor. Getting your card from the outpatients department can take 2 to 3 hours, and another hour or so before the nurse takes your temperature and blood pressure. Then there's another long queue, and yet another hour or 2 before the patient sees the doctor.
We usually work 24/7. I must confess, it gets to a time it's really stressful. There are a few times you feel like just running off a little, but
the staff here is hardworking and dedicated, but significantly, the hospital does not have a functioning blood bank or standby ambulance. This can lead to tragic outcomes, as was the case of Charity.
She was bleeding so much, there was no way we could refer anywhere. We had to go in. She arrested many times, and we don't have a ventilator to ventilate her, and unfortunately she died.
Sadly, maternal deaths are still too frequent. Many people would say that each death is one too many, and most families have a story to tell.
I'm a dog.
We attended Charity's funeral at her family house. She was born here and grew up into a young lady looking forward to a bright future. She left for Nigeria in her late teens, where she met her husband and gave birth to 5 children. She lost the 6th through a cesarean operation and developed severe complications with her 7th. When her condition deteriorated, Charity took one of the longest journeys of her life back to Ghana. Sadly, she lost her life at Keta Municipal Hospital.
Keta Hospital now, they did the operation normal, the way I saw it. I thought it's no problem. But before we know, she's give up.
Maternal deaths come at such a high human cost. Children lose their mothers, husbands lose their wives, and families lose a loved one. Women are such pivotal supports in the family, and when one dies, especially at such a young age, it affects the whole community. Many people here speak fondly of her and speak of her kindness and her bubbly character. Everyone came and gave their last respects at her funeral. A few miles from Charity's house is the home of Madame Agbemava, who also recently lost her daughter when she went to the hospital to give birth. The photographs evoke instant memories. For a grieving mother, it all seemed like yesterday. Jennifer had not delivered weeks after she was due. After complications exacerbated by delays at the hospital, she died.
I'm not a doctor. What you say at the age, you have helped me.
The moment to deliver the bad news came. The doctor walked into the room with a red pen, a known symbol of a bad omen here.
My heart cut and I saw him holding the pen. And then she said how many children I have. Because of the red pen, I asked him, even if I have 20 children, that is why you shouldn't have my daughter. She would die. And when I said that, then I fainted. And she didn't deliver. I thought she died with the baby. Jennifer, Jijo.
This is Charity's final resting place. Most would say she's gone too soon. In a profound sense, her life did not have to end so abruptly. What is to be done to ensure that another woman does not suffer the same fate that Charity did is the message from Keta. Welcome to the discussion segment of the program. Charity's story clearly raises important issues that deserve further interrogation. This discussion is only the beginning that will deepen and bear fruit as all citizens, mothers, fathers, politicians, farmers, midwives, the young and the old, all join hands to seek an urgent answer to why so many of our women are dying giving birth.
With me in the studio to shed more light on some of the issues you witnessed in the documentary. On my far right, I have Professor Fred Binka, currently the Vice Chancellor of the University of Health and Allied Sciences in the Volta region. Prof, you're welcome.
Thank you.
And on my immediate right, I have Madame Lucy Amegbo. She's the mother of Jennifer, who sadly we lost, and we saw that in the documentary. Auntie Lucy, you're welcome.
Thank you. You're so welcome.
Right. And we're well positioned with the Regional Director of Health in the Volta region on my left, Dr. Joseph Nwete. You're also welcome, sir.
Thank you.
I'll start with the sad story of Jennifer, 28 years old. We lost her last year, and you saw that in the documentary. Auntie Lucy, so you went to the Anloga clinic and you were referred to Keta.
Yes, it's so.
Right. When did you notice or think that there was something wrong?
We were there, they admitted her. That was Wednesday.
Mm-hmm.
She was there. And then I'll be coming home. When it was Thursday, when I take food to her, I saw that they are bringing her from the doctor.
Mm-hmm.
When I entered the ward, and I asked her, what is happening? She said, they say she should deliver. She will deliver today. I said, okay, we are praying for God. So I left to go and prepare food again. Brought in. I left the hospital about 10 a.m. because at our area there, when you say about 11, you can't get, because the children are with me in the house. There's nobody. On Thursday, that was on Thursday morning, I went again. I'll be going there. Then on Saturday, I was there. Then I asked her, what is happening? What did the doctor say? She said, they said they will instead some medicine to her to deliver.
To induce labor, yeah.
And I said, how? That was on the fourth day. Then I said, how? I went to the midwife, and they said the medicine is not there. That we should go to Aflau. So I said, the medicine will be there. Why Aflau? When we were going, one of the nurses called me and said, the medicine here. Then my friend said, I stayed the truth. And I said, that is how is it? When I pay, and I said I should go out. And I went out. About 3:34, I done. Then the nurse came and called me, doctor said I should come. I was thinking, I'll go and hear your news. So when I entered, I said I should sit down. And the question he asked me, he said, how many children I have? Then I know that something is happening. I told him, doctor, if I have 20 children, then you should kill my daughter for me. I know I lost my daughter.
At that time, had you been told?
No, they didn't tell me anything. But because of what I saw, and the question she asked me, because you can't ask me that question.
Dr. Nwete, you are the Regional Director of Health. These things have a big impact. It's a big blow for a family. From your perch point as a medical professional, what's the impact of these kinds of deaths on the family?
For me, I also get emotional when we lose a woman.
Let me bring in Prof. Binka here. I mean, should we have women disproportionately disadvantaged just because they are undertaking their biological role?
Definitely no. If you have the mammalian species, that also goes through the same process. You don't find the same level of mortality. So it doesn't make sense for a woman who is trying to give life to a child to die in the process. And we do have the know-how to make sure that we can have women give birth safely, even to intervene in very difficult situations.
Prof, let me ask you, I mean, why are women dying then if we have the capacity to prevent these mishaps, if I can call them such?
First of all, the women are dying because we don't have enough people to look after them. So if you look at the human capacity that is required, the doctors, the midwives. Secondly, our facilities also sometimes are run down. The support systems, the blood that needs to be given to the woman, the drugs that need to be available. In this story we heard they had to go to look for drugs. All those support systems are not adequately in place.
Something basic to induce labor.
You know, there should not be any need for traveling anywhere. And those times that those times that we lose really becomes very critical.
Critical delays.
Critical delays actually causes the death because this is just a small section of the whole continuum from inception up to delivery. And there's no need for us to have those failures at those material periods.
Right.
So it's a failure of our system, to put it, to just summarize.
Bluntly, maybe we didn't give Jennifer the best chance. Maybe we are responsible for the pain that you see in Auntie Lucy's face and in her voice. But Auntie Lucy, I mean, sharing with us again, I mean, do you think the hospital could have, should have helped to save Jennifer?
They should have helped her that day because she was in labor. But they just admitted her, give her some medicine. And she was there for 4 days.
So she's talking about delays. She says she's not a doctor, but she's a woman. She's a mother And I dare say she knows what she's talking about. Dr. Nwete, I mean, you oversee the whole system, specifically in the Volta region. I mean, what would account for this kind of delay, and then sometimes even after the delay, then you are referred to another place where the delay is extended?
No, in discussing maternal mortality, we normally discuss it within the context of the 3 delays.
Okay.
The delay in deciding to seek medical care,
okay,
the delay in getting to the health facility, and then the delay within, after the person has come to the health facility,
right,
delay in getting the appropriate care. From what we are hearing, in the case of Jennifer, obviously the delay was within the system.
Her mother was prompting her to go to the hospital. She made sure she went, and she arrived.
She arrived and spent 4 days.
4 days.
Only to die.
Yes.
So obviously, this is something that, to put it bluntly, is unpardonable. For a mother to came early, and we delayed for over 72 hours to give the appropriate medical care. That is not right. But again, in the facilities, they also have challenges. The personnel. We know the major cause of death is the hemorrhage.
Right.
So, but we didn't hear anything about that. And there's no reason why they shouldn't have what they needed, basic things
to induce labor.
It's system failure. Keta is a very big place, and for 2 doctors to be, taking care of the people. And
would I be able to come in there and also add your word there? 2 doctors for a big hospital like Keta, unpardonable, unacceptable, untenable?
Yeah.
But that is what we live with.
That's the situation we have. There are some hospitals, some hospitals with just one person. You can imagine. There are some districts with no midwife.
Right. As a regional director of health, do you have any control over the strings, the push and pull factors that would allocate or place a doctor or a nurse at this facility where it is critically needed?
When I get a doctors, I post to places where they are needed. And just as I was saying, in 2011, 7 doctors were posted to the Volta region.
Right.
None came.
They refused the posting.
They just didn't come at all. In 2012, 11 doctors were posted. None came. 2 came over to want to find out when they could report.
Right.
And I said, okay. They said we should give them some time. Like, how long? I said, 1 month.
These are people who've sworn the Hippocratic Oath to save lives. How does the system respond? And I'll probably take a word from you, Prof, on this, because a doctor has been duly posted. Most of them have been duly trained with our scarce resources, and they refuse to report. How does the system treat such people?
You see, it's a bit difficult, and it's becoming frustrating for regional directors. The system, as in the health system, must take part of the blame.
Right.
Because you post people, and then after a few months, you get another letter, their postings have been reviewed to Greater Accra.
Clearly, there's a failure of the system. There should be no review of postings. And in fact, postings people must be employed to fill vacancies.
Right.
And that's what should be done in the first place. We all know that. Secondly, people must be motivated to go to those difficult areas.
Right.
And we know the reasons for
Are we talking money here when you say must be motivated?
We are talking money. We are talking about there are things that people gain and lose for making those decisions to move.
Right.
So money is critical. But then if you are in Accra, your children can have better schools. Your wife may get a job. If you are posted to Nkwanta, maybe you are the only one who work, your wife might not work, and so on.
Right.
So all these things must be taken into consideration. Must be addressed. So it doesn't make any sense to continue to pay the person who is in Nkwanta the same salary you pay in Accra.
Right. Are you suggesting that is what exists now?
That is what is the same pay
if
anywhere.
A doctor, a midwife, a nurse works in some of these locations, they get the same...
The same pay for the same qualification. If you If you're a medical officer in Ghana, it's the same salary everywhere. If you're a midwife, it's the same salary everywhere.
But Prof, if I may, pick up on that. You sat at the helm of public health research. We've known these things for a long time. How come this has not translated to policy shifts? I'm getting more and more convinced, sad to say, that then there will be many more Jennifers. And I must ask, Auntie Lucy, listening to the people who pull the strings and run the system, how does this make you feel? It means that the average woman who walks in with joy and expectation is almost doomed. How does it make you feel as a woman, as a mother?
I don't understand. Yes, had I known that it would be like that, I should have taken.
Do you have a midwife at home when you delivered?
No. My elder mother used to deliver for people.
Okay.
So I deliver in the house. He do everything for me. Just bring I don't know.
Right.
I should have listened to her and take her away.
And I'm sure this is something that haunts you.
In fact, the problem with maternal deaths in this country is really being driven by poverty. Those who are poor have less access, and those who are rich, you don't hear this is happening in those areas. So
essentially, we've been paying lip service to all this feedback we get from our system each time. We report figures and statistics to the WHO, but figures should tell us something and should inform our decisions and our policies, and we are not doing it.
That's one. Number two, we should stop providing average figures. You know, we must know the figures by region and by district.
The real figures, not
so that we,
institutional figures.
Not those institutional figures.
Some say that when we get the real figures, it affects what our donors and our partners give us and other things. And so there's a way of tidying it up and massaging figures to look presentable.
Then it doesn't help us to solve the problem. Because we mask where the problems are and where we need to put in extra effort to make sure that we save the woman.
Right. Yes, no woman, and I'm going to say it again, no woman, and that's not Bob Marley. This is the Maternal Health Channel. We're saying no woman should go to deliver a child, seek to give life, and die. I know countless families are being touched by this discussion. So, Auntie Lucy, I know you have fond memories of Jennifer.
That is true.
Yeah. What would you want to share with us?
I would say we should try to improve the system of our hospitals so that many souls should not perish as it happened to my daughter.
Right.
Her soul should rest in peace.
And to you, our listeners and viewers, we say thank you. Join us every week on the Maternal Health Channel. Good night.
We don't expect any woman to go to the hospital to deliver and die.
It makes me feel angry. Angry because it looks as if we are toying with the lives of women.
BNI Obano afọ loke bile bashia. Boda nje no ti o na mi se. O wo ku be ni o sha fe na mi se. Si ko bile bashia. Sha fe ngon. Ma mi fe jo ku cho fe e fine. No je papa.
Every maternal death tells a story. And these are the stories as policy makers that we are interested in knowing to enable us put in place practical solutions to these avoidable deaths.
Masama mede magana fo no se mesre biala. Se be fe yefunu a ebia be hwe no ho so ye. Ama wo na ye kwaye mma no no so watwa. Osanse ma ye ba atane ma ye hema. Yetene sa ne ye ho tete.
My name is Dr. Koma S.J. Huapia, the country director for IvyProsper Ghana. IvyProsper believes that no woman should die giving birth to another life. Every outcome of pregnancy should see a woman who is alive. Maternal mortality is a rare indicator in public health, and Ghana should strive to reduce the institutional figures of 351 per 100,000 live births. We should help reduce such needless and senseless deaths amongst our women. Keep watching.
Next week, the program will present the second part of Charity's story. What exactly happened that night when a taxi rushed a dying Charity through the gates of the Keta Municipal Hospital? Thanks for watching, and good night.